Good day everybody, this is Florian Landman from Key Wealth, and in this video we're just going to have a quick overview of how the Discovery Core plans work for 2025, and this is a basic information session, if I can call it that. And at any time do pause the video or do open the brochure and just have a look at any specific limits or any exclusions or any benefits that you would like to see. And then also you're always welcome to reach out to us. So the core series is divided into 5 options. We've got the classic core, which is 200% in hospital, the classic Delta core. Let me just change the color here. We have the classic Delta core, which is also 200% in hospital, but it makes use of network hospitals. The Essential Core, which is 100% hospital cover, the Essential Delta Core, which is also 100% hospital cover, and it makes use of network hospitals. And then we've got the coastal plans, which are at the 4 coastal regions in South Africa. So you can use any hospital that's on their network within those coastal regions. All right, so let's dive in. I'm going to skip quite a bit because there's a lot of information in this brochure and I don't want to make this video too lengthy. There's a couple of things where they break down what certain abbreviations or certain words mean within this brochure, so you can have a look at that. And then what's important for us to stop by is here where I mentioned in the start of this video. Here you can see which hospitals you can use and how they cover for it. So that's also very important. Oh, I didn't mention this. The coastal plans are covered at 100% Discovery Health rate. So just make note of that. And then here it breaks down very nicely how those plans work. Remember that the core series is primarily hospital cover. So that means you've got a band around your arm and a bed to sleep in. And then your medical aid with Discovery on the coastal plan will kick in. So Discovery has launched a very interesting thing for 2025, which they call the Personal Health Pathway. You get access to this by downloading the Discovery Health app, and then this program will tell you step by step. Here it says download the app, review and start, and then it will give you little bits of details and things that you have to do. So number 1 on this screen that you can see here is go for a health check. And what they do then is they will actually give you 500 Rand in a health fund to use for medical expenses. That's the number 4 reward part. So a little bit more on that later in this video. Here you can see, just as we get to the next page on this brochure, here you can see some of the things, if you pause the video, what you can expect from this step-by-step guide to be more healthy. So it will be select a GP, go for a health check, vitality assessment, or if you're someone with a chronic condition, it might be go for a blood sugar test or do a mammogram, etc. So this is very individualized and personalized, and this would be based around your specific and unique situation to make you more healthy. Okay, so here's a little bit of a breakdown for it. On the core plans, on the classic option, you will be able to receive up to 2,000 Rand per adult and 1,000 Rand per child, up to a maximum of 8,000 Rand per family in your personal health fund for next year. On the coastal or essential plans, it's 1,000 Rand per adult and 500 Rand per child. This is still a very nice benefit for a husband, a wife, and 2 children. You can get up to 3,000 Rand of day-to-day benefits, essentially, because it's for medical expenses, excuse me, which you can get on a hospital plan. So that's very nice. And then something that's also very, very nice is that they've introduced a once-in-a-lifetime benefit where you'll get the same benefit once upfront if you join Discovery as a new member for the 1st of January 2025. So look into that, and you can essentially get 6,000 Rand if you switch over to Discovery, and you can get that in January. Well, not all of it up front. You'll get 3,000 Rand up front and 3,000 Rand as you go through your personal health journey. Right, I'm just skipping through a few things here. Discovery has a lot of benefits that a person can deep dive into. If you've got any questions around that, please reach out to us. They do some screening benefits. So the most common one that we use for our clients is screening for adults, and that's your general BMI, blood pressure, blood sugar, cholesterol, and HIV screening. They also do mammograms and pap smears depending on your age and your health criteria, as well as a PSA test for the men. And then there are some screening for the seniors available as well. They do various unique type of screening. So if you are diabetic, for example, and you're registered with a diabetic program, then there are different things that you can get on that. And also like pap smears for HPV tests and cervical cancer screening. Discovery has got quite a decent pregnancy benefit. They give you up to 8 consultations at a gynecologist, GP, or a midwife while you are pregnant. They pay for 2D sonars, which is very nice. And they also do these non-invasive prenatal tests. So that's very nice. And they also do these tests where they check whether a child possibly has something like Down syndrome. So that's very cool. If you do get a 3D or 4D scan, they will pay it up to the 2D scan limit, just so that you're aware about that. They do pay for 1 flu vaccination while you're pregnant. They pay for a defined list of blood tests. And then a very nice benefit is that they pay for 2 GP or pediatrician, ear, nose, and or throat specialist visits after you've given birth. So that's also a very nice thing. And then they pay for up to 5 pre and postnatal classes. So that's also a very, very cool thing that Discovery does. So very, very nice benefit that they've got here. One thing just to note on this, something that Discovery does not pay for is the baby immunizations. So just be aware of that. They do cover chronic conditions. Please take note that there is a predefined list of 27 chronic conditions with all medical schemes that they have to pay, and then some options or some schemes that they pay a little bit more, but those are a little bit more expensive. So Discovery does pay for them, and then you can pause the video here and then just check whether the condition that you might have or something that's in question, whether it's covered here, and then you can reach out to us if we can help you to register for that if it has not been done. They've got several managed care programs, so things that are popular are things like the diabetes care program. They've got a new thing, depression risk management program, which is very nice. They've got a mental health care program, HIV program, cardio care program. So all of those are things where Discovery might identify that you need a little bit more care, or it is something like the diabetic care program where if you are diabetic, then you can register on it. With oncology, always a very important thing to know how your medical scheme funds it. So with Discovery, they cover it in a 12-month cycle, meaning if you get diagnosed with cancer in July, as an example, you'll have your 12-month cycle will be from July to June the following year, and it does not reset on a calendar year the 1st of January, but it's a 12-month cycle. They pay for the first 250,000 Rand on the core plans. After that, you've got an unlimited benefit, but with a 20% co-payment, so just be aware of that. And then also, they do have service providers to use for your oncology drugs. And if you do not use that, then you can have a 20% co-payment as well. So just be aware of that. Okay, this is a hospital plan. So just a brief explanation of how it works within the hospital. Your hospital account is covered unlimited, and that means that if you are in hospital and there's a reason for you to be there and you've done your pre-authorization and it's a serious case where it's required for you to stay for as long as you need, even if the bill is 5 million Rand, there's no set limit to where they will stop. Just be aware that you have cover at either 100% or 200% the Discovery Health rate, meaning if a specialist charges above 100%, then you might be liable for the difference, or above 200%, then you might be liable for the difference of what they charge and what Discovery pays. So for those reasons, that's why we recommend a gap cover for that and all the co-payments, etc. So just so that you're aware of it, on the Delta plans, there's a 10,700 Rand co-payment if you go to a hospital that's not on your hospital network. So please check those hospital networks up front so that you know. On the coastal plans, it works a little bit different. Discovery will pay 70% of the Discovery Health rate if you go to a hospital that's not on the network. Just remember that if you go to a hospital on either of those options where it is a network hospital, then the co-payment falls away, and in this situation they'll pay 100% of the bill. There are a list of predefined conditions where you'll have to pay a 7,000 Rand co-payment, so just be aware of that. And then the Delta options, 10,700 Rand if it's outside of the day surgery network. All of these co-payments can be settled by a gap cover. So the gap cover pays for the co-payments as well as the short payments if it's charged above of 100 or 200%. Another point of interest, just to take note of, is how Discovery funds MRI and CT scans. If you're admitted into a hospital, you've got MRI and CT scans will be paid in full. And if it's for conservative back and neck treatment, in other words, you don't need surgery, or how their definition defines it, you do not have a benefit for an MRI or CT scan. So generally you don't have out-of-hospital MRI and CT scans with core options with Discovery, so that's something to take note of. And then also just note that a new cataract surgery network has been introduced for 2025, and if you do not use that network, Discovery will pay 80% of the cost, meaning that you will have to pay the 20% balance. There's a lot of information regarding scopes, so I'm not going to dive into this too much, but if you go for a scope, so gastroscopy, colonoscopy, or something like that, then if it's in a day clinic, there's a 4,500 Rand co-payment on some of the options, and on other, if you do both or more than one, or a gastroscopy and a colonoscopy, it's a 5,500 Rand co-payment. In a hospital, it's 7,700. And then if you do this in out of hospital, in room, but not in a network provider, then there's 1,750 or 3,000 Rand co-payment. If you do it in a doctor's room where it's part of a network, no co-payment excuse me, will apply to that. Just interesting to take note of it, there are some criteria here. So as an example, if a patient is 12 or under, then there is also no co-payment. So with certain criteria, also if it's a prescribed minimum benefit, so it might be that you do not have to pay the co-payment, but just always be aware of any co-payments you might have on your option. There are some benefits that have what we call sublimits, and here are some of them. It's things like cochlear implants, internal nerve stimulators, major joint surgeries, shoulder joint prosthesis, and things like that. So Discovery also pays for 21 days for alcohol and drug rehabilitation, and also for mental health, 21 days that they pay of admissions, or up to 15 days or 15 out of hospital consultations. So that's something that you can also make use of. If you go to hospital on this option for any dental facilities or dental treatment, just know that if you're older than 13, it's 8,650 Rand co-payment in hospital, or 5,550 in a day clinic. And if you are under 13, it drops down to 3,350 or 1,500 Rand respectively. So just be aware of that. And then this would not be for normal things like fillings and extractions and things like that. So it would be for severe dental or oral surgery in hospital. So if you have any questions regarding that, or something like wisdom teeth that has to be removed, so if you've got any questions, just give us a shout. You are covered for certain procedures in day surgery networks. You can pause on this next slide. There you go. You can pause here to have a look at what's covered on the day surgery list. And if there's something that you might have to go for, just check in with us so that we can assist you with a pre-authorization. With Discovery's core plans, you also have access to the international travel benefit. So depending on where you go, you can always ask us and we can assist you. It might be an extraction or evacuation, or a cover that you get outside of Africa, which is limited to 5 million per person on each journey, and also only up to 90 days at a time. There are many other programs that they offer as well. So they've got a spinal care program, Africa evacuation cover, certain in-room procedures that are covered, World Health Organization global outbreak. This is something that's like what happened with COVID, where they pay for the vaccines, which is very nice. And then this is a new benefit also, where they provide support to supportive post-operative program, where they give for certain surgical procedures, they give you a little bit of benefits out of hospital, a defined basket of care, post-operative care that you've got relating to your procedure. So that's also very nice. And then here you can pause again on the contributions. You can see here are the premiums for the main members. And then this would be for your adult dependents. And then here we have your child dependents. Okay, so with Discovery, you only pay for 3 children. So if you have 4 children, the 4th one is for free. So thank you guys for taking the time to watch this video. I know that it's a very brief explanation of what Discovery covers. And if you do have any questions, just give us a shout and we'll gladly assist you to do an option change or to assist you with any of the other medical schemes that we are contracted with. This is Froan Landman from Key Wealth, and until next time, goodbye.